talk about some of the what we call transcultural issues in infant care or children's how to manage children's behavior and promoting certain qualities versus other qualities. And we call this presentation transcultural issues in the Midwest of the United States only because I am more familiar with these circumstances, having lived here for 20 years. And of course, this is not to be taken as a statement about how parents do things in the Midwest. It is just an evocative theme to highlight certain differences in how cultures might perceive things in different ways. We realize there is a great deal of diversity in how parents do things in any region because of the sheer different backgrounds and so on. But there might be some cultural themes that might be important to highlight and focus on. So I will try to do that. Maybe in a very broad sense, one could say that there are some styles of caregiving according to cultures. We put them in two extremes just to make a contrast between them. One is a cultural theme that promotes independence, individuation, the child relying on himself, sometimes as soon as possible. And the other is, in the other extreme, a culture that promotes belonging to a family, dependency, where the child relies on the parents a long period of time, and the parents promote precisely the child not to be self-reliant in order to convey the sense that he is a part of a system rather than an individual, and that his behavior affects the whole family. So one is not thought as an individual being with unique choices, but as a part of a wider system that has certain protections and certain duties as a part of that system. So we're going to here evoke these two kind of poles, and there are some variations and points in the middle, but just for the contrast, I will highlight some of the practices that might fit in one or the other mode, but taking as a point of departure what we sometimes see as commonly accepted practices in the Midwest of the US. So we are referring to families of European origin, usually mostly Northern European, as British and German, where certain themes and traditions have been inherited from one generation to the other, and where certain values are held very highly, such as self-reliance. This is one of the things that parents want for their children. When we ask parents, what do you want your child to be as an adult, one of the first things we hear is we want him to be independent, to be able to be a productive person, to rely on himself, etc. While if we asked a parent from Sri Lanka or Guatemala or Mexico, they might say, I want him to be a good person, who be a good family member, and who does good things. So, different things that parents want for their children. So, for instance, with crying, a recent survey from 0 to 3 still shows that maybe over a third of parents in the US and many parents that we see are very worried about the child being picked up when he cries, fearing the problem of spoiling, that if one responds too quickly, the child will be spoiled and become very dependent, manipulative, or not self-reliant enough, or a wimp, or will be too needy. This is a theme that keeps popping up in our conversations with parents, the fear that the child will be too needy and not learn to rely on himself. While in other cultures, empirically, it has been observed that parents are very worried that the baby will cry, and they immediately pick the baby up or respond by feeding or doing something else. Sometimes here we hear relatives and grandmothers advise to leave the baby alone, to let him to cry himself to sleep, to let the baby cry and not to get him up too quickly, because in that way the baby will learn to soothe himself. Even the Brazelton scale, for instance, gives higher ratings for self-soothing to a baby who is more competent to soothe himself, such as putting his hand in his mouth, responding to less intervention by the caregiver as opposed to picking the baby up and rocking him. So, there is a value in the idea of the baby being able to soothe himself. While a mother in the US, when a toddler falls down, might be worried, she might stop herself from picking up the toddler immediately and saying, "Come on, you can get up. You are strong, you are tough," and promoting not crying so that the baby will cope with this by himself. A mother from another country might immediately pick up the child and elicit crying as a way of showing closeness and love between the mother and the child. And we'll talk about some of these other things also in terms of discipline and so on. So the theme is the crying should be discouraged because it is a signal of the child needing perhaps a little too much, and less crying is better. We certainly see that also in daycares. When a mother leaves the baby, the caregivers are very worried that the child not cry, and they try to help the child not to cry, and if the child doesn't cry, the caregiver assumes the baby is just fine, even when the baby might still very anxious and worried about having seen his mother leave. The fact that he doesn't cry is seen as a sign of being okay, even when inside the child might feel very uncertain. So this is an important cultural theme. Another one that we often struggle with is feeding. There are always a number of traditions in all cultures about how one should eat, and the polarization that we see here often is, for instance, seeing the feeding situation as a maneuver to introduce calories in your body versus a social situation where one shares the food as a part of the maternal love, as a part of, again, being a member of the family. So on the one hand, the baby might be fed by himself in a high chair, and he has to exercise as quickly as possible the ability to eat by himself. We see mothers, for instance, that prop the bottles, or very early on teach the baby to hold the bottle on their hands, with their hands, so that they feed themselves. And as the child gets older, they promote quickly self-feeding skills versus a more typical third world strategy of either kiss feeding the baby, or pre-chewing the food and giving it to the child, or spoon feeding them for a longer period of time, because again the mom wants to convey this dependency strategy to the child. Then as the child gets older, we see in the Midwest the introduction of a number of rules that sometimes babies can cope with, or toddlers can cope with, but sometimes they can't, and they lead to problems, such as favorite rules seem to be cleaning up one's plate before one can get a second of a favorite food, trying one of everything, having to sit, not play while you eat. The feeding situation is not a play situation, but a feeding maneuver, etc. While again, in other contexts, parents do not hesitate to play with their child and to kind of make it a much longer affair. That sometimes in the US they recommend 20 minutes to half an hour to eat, while in other cultures people eat for a long time, and they really use it more as a social bonding strategy rather than just the act of eating. And there is joking, there is sometimes even singing during the meal, and certainly we see babies that seem to eat better if they are in a more playful environment versus in a very business-like we are going to eat. So the social versus the individual again seems to be the theme. Sleeping is obviously another area that is strongly cultural, and one of the interests in talking about this topic is that one could not say that one culture is better than the other, and certainly children are born in a certain culture, but their style might not be the best fit for that cultural practice, and also that sometimes, given the dominance of the United States and the media and in publications, the things that are practiced in the United States are published elsewhere and recommended to parents, for instance, immigrant parents, as if they were the best practices or the more advanced or the more scientific. And we see sometimes parents being advised to abandon all practices because they are just not what we do here, which is perceived as perhaps better, when there is no evidence that this is the case in most circumstances. So sleep is another one that, for instance, the common advice certainly in the Midwest and most of the US is for the baby to sleep in his own bed if possible, because of the fear that the parent will roll over the child, when there is really no good scientific evidence that that is the case. The UNICEF in the UK and many other organizations now recommend to sleep with the baby as their standard recommendation, provided the parent doesn't smoke and doesn't use drugs or is an alcoholic. There is no really chance that you would roll over your child. But in any case, the recommendation is commonly here in the US, the child should sleep in the bed, in his own bed, and in that way he can learn to sleep on his own, need the parent less, and if the child would wake up in the night, giving him the chance to soothe himself to go back to sleep. And again, that promotes this individuation and relying on himself. Some parents also, and this is a common recommendation, is some parents practice to put the child in the bed just before he is asleep. This is a frequent recommendation as well. And even if the child fusses a little before he goes to sleep, parents are advised to let him cry himself to sleep. And again, this, if we recommended that to parents from other countries, they would find that very surprising. Even the idea of sleeping in another room is strange, because there are not very many rooms in the house. There might be predators, such as animals, mice or rats, that could endanger the baby, so the mother wants to be with her baby. And also, they would not understand why is it so important not to rock the baby or not to respond when the baby is crying at night, because the mother sees her role, or the father, as being there to soothe the child. So, the preferences here are clearly cultural. Another topic that is very important is this limit setting and discipline for the toddler usually. How does one deal with negative or undesirable behavior? What should one do about it? And here we see a strongly cultural element. What we commonly see in the Midwest of the US is some parental beliefs that are pretty pervasive, such as the child should be punished if he does something wrong in order to learn. There is still, I think, pretty pervasive idea that the child has negative inclinations, that if they are not curtailed, they will continue to grow and they should be abolished. Parents are very worried that if a toddler or older child does something wrong, he would not be punished, because one has to learn from one's mistakes and learn to take the consequences, or as they call it, natural consequences for misbehavior. So there are many menus that are created and books that recommend the strategies such as counting 1, 2, 3, and then you get a negative consequence, or punishing you if you do something wrong using timeouts is pretty pervasive, although I'm glad that I see it being used less in the more sophisticated daycare centers. But this notion that timeout should be given at a ratio of 1 minute per year of age has really no basis in any scientific information that I am aware of, and certainly is a quite artificial technique seen from another cultural point of view, which is a distancing technique where one ignores the child and doesn't interact with him for a given period of time. We like to think how adults might feel if their spouse or a loved person would not respond to them when they are upset or when they are angry. They would be ignored or not talked to. We do these things to children, but they certainly could be quite scary for some infants and children who are very sensitive to be given a timeout, while other approaches such as reasoning and talking to a child, explaining what they should do instead, or admonishing might be possible as well. So in many traditional societies, distancing techniques are not known. You know, when you deal with parents that are immigrant, they would be very surprised that parents give timeouts or send people to their rooms to cool off, or as a punishment certainly, or withdrawing, as we say here, privileges from children because they are a part of everyday life, such as watching TV or whatever. So withdrawing of attention and a kind of a distancing strategy is not practiced in many cultures, and here it is often practiced. But I think often unnecessarily. I think many children who get timeouts should not get them because they would respond well to just explanations from their parents and without needing of a punishment. Another cultural value is again the creation of a very independent and assertive child who learns from his own mistakes and has a sense of pride in his own accomplishments, versus a child who is taught that relying on others is okay, that you don't necessarily achieve individual accomplishments but more group accomplishments. For instance, in preschools in Japan, children are often given a role as a part of a group, and they develop group projects, and parents are very interested that the child doesn't necessarily become the star individually, but more a member of the small community of children who do things together. Here we use, we see many parents using also long-distance maneuvers to control children's behavior, such as using words, the word no, stop, using verbal strategies, versus using the body to move the child to another location, to re-engage the child. And sometimes children are simply not able to control themselves just by verbal strategies. Also, we see many parents getting into face-to-face confrontations with children because the parent expects that the child will understand words such as no, stop, don't go out, etc. And children sometimes get into confrontations with their parents who insist on yes, no, when other strategies such as distracting, re-engaging the child, holding, touching might diminish this anger and sort of the sense of confrontation. In traditional Japan, the mother hardly ever gave commands to the child, because the mother is very interested in creating this state of amae in the child, which is a state of blissful interdependency on the mother. So the mother might very indirectly suggest to the child to pick up his toys, as opposed to pick up your toys, and then the child says no. She might even not give the request when she knows the child is not in a state likely to pick up the toys, because it is very important for the child and the mother to maintain a state of mutual cooperation. So the child will eventually learn to try to please the mother as the mother tries to please the child and maintain this harmony. And I think we could learn quite a lot from this, as we see sometimes very aggressive techniques of dealing with children who are very strong-willed and who cannot just stop what they are doing in a few seconds. And sometimes caregivers are very interested in teaching this to children, to quickly comply with rules. They emphasize obedience a great deal, despite the stated cultural value of independence and self-reliance. Very often parents are very interested in obedience, so that the child learns to comply quickly with authority figures. Finally, one wonders whether certain strategies of caregiving really fit with certain cultural patterns, such as in a very industrialized capitalistic society where people have high social mobility, where they will not have an extended family, where they will have to rely more on themselves. These parenting strategies help, so to speak, children to cope with being alone, with not counting on others, while in more traditional societies people won't move. They will be with the same family all their life. They perfectly well can depend on them. So this self-reliance is not as necessary. Well, thank you very much.